太棒了啊！真的感谢他把这个就是我们在大型的医疗诊所所用的这样的频率仪器送到了百姓之家哈，我们就不用去学那些专业知识都可以用，真的是好棒。那我有注意到哈，在就是我们的 Mcmakin 里边这个经典的应用里边有一个睡眠，然后在这个就是 Mcmakin 的 application 里边也有睡眠。那在 Healy 里边我们还有这种系统睡眠啊、平衡睡眠。那我想知道他们三者有什么样的区别？
So Stella was asking, thank you for sharing your insight regarding the Meridian system. It really actually, with the technology like the McHealy, it allows the normal public, everybody, to able to use the FSM or to use the frequency microcurrent therapy to help support our well-being without specific training or knowledge. Going back to McHealy, there's actually different module. Let's say in the classic module, we know that the classic module is compiled from different frequency therapy systems. One of them is the sleep program, but also inside Mcmakin, the module, there's also a sleep program. Do you happen to know like what's the difference or how they might be?
I don't know. They asked me for our protocol for sleep and the specific, I'm not sure I'm allowed to say this, so I'll just take my chances. Specific frequencies for in our sleep program are to quiet the sympathetic nerves, to quiet the adrenals, and improve the function of the pineal gland, and quiet the cortex, the part of your brain that stays awake and thinks. And then increase secretions in the pineal gland to increase melatonin. And also, I think there are frequencies in there for emotions that might be keeping you awake. So you quiet the adrenals, quiet the stress response, quiet the medulla, increase secretions from the pineal, and then balance emotions that are disturbing, such as fear or worry or anger or resentment, and then finish with the frequency for restoring joy, which would be a good way to fall asleep.
Oh, thank you. Let's translate that in Chinese. So 刚刚 Stella 老师问的关于这个睡眠的程序 ，Mcmakin 医师说他不清楚其他的模块里面的睡眠程序的这些频率的功效，但是根据他自己在 Mcmakin 模块里面编写的这个程序当中，他说他也许可能不太确定能否在这里说这些话哦，但是他就是就跟大家分享了，就是说这个 Mcmakin 里面的这个睡眠的程序当中，他首先开始的一个流程呢，就是说他首先会去帮助去安抚，或者是让我们去降低这个交感神经的这个亢奋的一个状态，他会去缓解就是这个肾上腺素过分的紧张，或者是过分的活跃，然后它还会帮助我们的这个松果体，然后去提升，比如说褪黑色素的这样的一个释放，这些还有很多比如说脑部里面的这些化学的作用。那还有就是说它还会去平衡我们的一些情绪，因为当你有一些负面情绪的时候，它也会让你没办法休息或睡眠，所以里面比如说有恐惧啊、担忧啊等等的这些频率在里面。最后呢，就是像是刚刚有说到的97033，就是让你可以恢复到喜悦的这个频率。So the restored joy, is it the 97033 that you wrote on our books?
Yes, 97033.
I got that.
It's the only frequency that I developed myself.
Oh,
so
wow.
The original list came with frequencies for removing fear and worry, and I was negotiating a contract to lecture with a big company to lecture in Australia. And I was so worried and so stressed about making a mistake that I sat in bed one night and ran for 30 minutes the frequency to remove fear. And then another 30 minutes to run more kidney fear, like yin fear, like watery, worry, over concern. those two. Well, at the end of the hour, I wasn't afraid, but I didn't feel anything. It's like I felt numb, right?
Mm-hmm.
And I thought, well, 970 is for emotional. What is the organ associated with joy? That would be the heart, right? The heart center. So I ran 970 and 33, and it made me feel good and happy. And so now that was on the list. That's the only one I've developed myself.
Wonderful. So 刚刚Mcmakin医师说，我刚猜他这个喜悦的频率是不是970跟33？之前跟大家分享过，他说没错，这是970、33，是他自己研发出来的这个频率的一个组合。那因为其他的这些频率可能是来自于之前 Von Golder 先生研发出来的，或者是 Abraham 这些先生研发出来的这些频率，但是970、33是他自己研发出来的。他怎么在这个过程当中去研发出来这个频率呢？是有一次他在澳大利亚那边有一个项目，有一个合作的项目，他就是非常的紧张以及担忧，他希望一切都是可以很顺利的进行，但是有一天晚上他就是非常的觉得恐惧跟有点担忧，所以他就把这个频率拿出来去应用一下在自己身上。他用了一个肾脏的程序，那我们知道说肾脏是跟恐惧方面有关系的，那他也用了一些关于恐惧跟担忧的这些频率，他发现用完了之后，他跑了大概30分钟，然后用完了之后大概1个小时，他发现他对于这次的这个合作项目的这个恐惧跟担忧就突然就消失了，好像自己觉得变得放松了这样的一个感觉，所以他就把他就想一下，他必须开发一个特别的一个频率给这种的情绪，所以他就说到970是针对情绪的，那33呢，有什么是喜悦的情绪是针对哪一个器官呢？就是我们的心，所以那33是相对应心脏的。So 9, 70 and 33 corresponds to the joy from the heart.
下一个问题哈，就是说，我有看过，就是他的很多的 YouTube 上的 video 和他的书哈。那我知道他是痛症的 top specialist， 同时呢，对运动损伤这方面哈，他有很多独到的见解和卓越的见识。那我想问的是，比如说我们就刚才举的例子 ACL injury， 就是那个前十字交叉印带这样的一个损伤，在他给我们的这个就是Mcmakin 的 application 里边，它只有一个 joint， 而且它是 dual frequency， 对吧？双频的。那他现在给我们的这个 joint， 它这个 program 里是不是把2个 A 电路和 B 电路都放在一起？而且如果都放在一起，它只是对于这个 joint 有帮助，还是对就是这种 ligament 或者是 related 的这些有帮助？可不可以这样认为
？So Stella was saying, through your 20 plus years of specialties, especially in pain management, you have helped a lot of you have actually seen a lot of miracles right in front of your eyes happen. And from a pain specialist point of view of your specialties, we were talking earlier discussing about like sports injuries. It's also one of the modalities in FSM. So Stella was mentioning, for example, if there's an ACL injury, and inside McHealy, there's the joint programs. So if you run the joint programs, does that mean there's dual frequencies coming out at the same time? And is it targeting the joint itself, or do we need other programs to supplement to balance the situation with like an ACL injury? Or is there tendon programs?
The joint programs are more general to all the tissues in the joint. So the cartilage, the ligament, the periosteum, the lining of the bone, the joint capsule, ligament, connective tissue, it's for the joint. ACL, if it's just a strain, you support the joint, you tape the joint, protect the joint, and you run current to repair the ligament, and that's a very specific program. I think that would be more successful than just the joint pain. So if you just have maybe a little arthritis or overuse in a joint, the joint program would be very helpful for a very specific injury like an ACL strain or hamstring strain or an Achilles strain, I actually don't think we put that in the McHealy. I don't have the list. There's 26 programs, and I think that I don't have them all in my head. Don't tell Michael.
No, we're not.
The other Michael.
Michael Dance. So 刚刚 Mcmakin 医师说到，就是说对于这个情况下呢，他会建议说，除了用 McHealy 之外，比如说有那个关节的这个程序之外，如果只是一般 ACL 这个韧带的一个拉伤的话，应该是可以帮助到的，但是也是需要比如说透过一些绷带把它固定好，然后这个 joint 的这个程序的话，是针对整个关节周围的这些组织都是有整个概括的一个帮助，就是没有那么直接说针对某一个部分的。So when you use the program, there will be two frequencies simultaneously being targeting that specific spot. Would you put the McHealy at, let's say, this location that you need to have the balance to be balancing, or how would you use it?
I find it's more effective when you have the magnetic field close to the joint. I think that is more effective.
Wow.
It depends on the program. So the nervous system, so brain balance, you can put that on your stomach. You don't want to put it next to your head, because the frequencies address the part of the brain that they're supposed to address, whether they're at the site or not. When it's a joint or your digestion or liver support, when it's a specific area, it's better if you have it right over that spot. So.
Okay. 刚刚我跟 Mcmakin 医师问说，如果我在用 McHealy 的时候，是不是在用 Mcmakin 程序的时候，是不是最好可以把这个 McHealy 放在需要调整的那个部位上？他就说，如果是比如说是消化道或者是某一个关节某一个部位是有状况的时候，你可以把 McHealy 放在那个部位上，因为透过这种电磁场的这种理疗，可以很好的去平衡那个部位的生物能量场。那但是如果是比较整体的，比如说像是头部的或者是脑部的这样子一个平衡的时候，他不建议你把 McHealy 放在头上，那可以比如说放在身体上或者胸口上比较合适一点，就按照你看你使用的一个目的跟方式，但是他不建议把 McHealy 放在头的旁边。那the McHealy, do you think is quite similar to PEMF? Because when we've seen from the technologies or your equipment that you use on your practice, there's the component of PEMF.
Yes.
Is McHealy in some way has this pulse magnetic field components, or do you know?
Yes, absolutely. So we have been using pulsed EMF. It turns frequency-specific electrical pulses into frequency-specific magnetic pulses, and we have been doing this for 6 or 7 years. And before I would let that company sell it, I had to convince myself that it was equal. Yes. And so I use our magnetic converter, our pulsed EMF that converts the electrical pulses to magnetic pulses on myself every night.
Every night, wow.
Yeah.
How about in your practice? In your practice, do you use that mostly, or do you still go back to the hot wet towel sometimes?
I use the wet towels and the frequencies mostly, but today I had a patient that had PTSD, and so that program is almost 2 hours, is 2 hours long. That's too long to sit with something wet. So I use the magnetic converter and just place them in her pockets, and she sat and played with her phone and slept, and it's very convenient, and it does work as well.
Okay, let me translate that. 那我刚刚问的Mcmakin 医师说，他关于这个，因为我们知道说他的这个诊所当中，他有应用到这个脉冲电磁场的这个疗法。那我所问他，是不是我们的 McHealy 也有这种的 PEMF 脉冲电磁场的这种疗法的元素在当中？他说的确是的。然后那所以就是说，在我们用某些指定程序的时候，你是可以把 McHealy 放在你身体指定的某一个部位。那在他诊所的应用当中，我刚刚也问了他说，他现在是不是大部分的时间都是在用这种的脉冲电磁场疗法呢？他说并不是，他说他大部分的时间还是用湿毛巾来去用这种的微电流频率的方式来去应用，但是看情况，有时候如果他那个程序时间需要比较长的，像他今天帮了一个PTSD 的客户做了一个调理，需要2个小时的时候，他就决定用那个脉冲电磁场的方式，因为如果你2个小时都垫着湿毛巾的话是很不舒服的，所以他自己每天晚上也会用这种脉冲电磁场的方式来去帮助平衡自己。
太棒了。那个山门，我刚才的那个问题啊，好像你还没给我问，就是说他现在在那个 Mcmakin 的 application 里边，他的比如说 joint 呀，或者是他其他的程序，他这一个 program 是不是里边含了 A 电路和 B 电路？这是我的问题，刚才的问题哈。那同时呢，他刚才有说到 joint 的时候呢，那我们知道在就是现在的这些人膝关节有问题，我们有很多这样的病人，包括我们的客户哈，就这个 cartilage是磨损掉了或者没有，他刚才也提到了哈。那平常在我们临床治疗的时候都是用，就是真的是没有办法，我们是做那个 PRP 啊，或者是打这个蛋白垫。那这种呢 cost 非常高，像就是有的时候 PRP 或者是 stem cell 都是超过2000加币哈。那就是作为一个比较，如果他这个 joint 对于这个 cartilage， 因为他刚才提到有这样的一个效果的话，那真的是 McHealy 是一个里程碑，为病人省了很多的钱，也减少很多的痛苦啊。因为我们现在在治疗的时候 ，hip 是不 cover 的，你知道的哈。
So Stella just wanted to confirm once again that when we use the McHealy with the Mcmakin frequencies, there's 2 dual frequencies coming out. That means there's channel A and channel B at the same time coming out from McHealy. Yep. Okay, so and that's confirmed.
When 2 frequencies cross in a field, you create a combination. You have in that space the frequency from A, the frequency from B, the sum of A plus B, and the difference of A minus B. All 4 of those are in the field. And even after 25 years, we don't know which part of that field is what is effective. So, but we do know that both frequencies have to be correct. So if you run the frequency for inflammation in the tendon, and the problem is inflammation in the bursa, now the bursa is 4 hertz away from the tendon. And that 4 hertz makes a difference.
Yes.
So if you run, yeah.
Okay. So 刚刚 Mcmakin 医师说到了，就是说的确就是在用 Mcmakin 频率的时候有双频的，有频道 A 跟频道 B 会同时释放出特定的频率。那在过去25年的实践当中，我们都知道说这个双频的作用，它同时会释放出 A 跟 B 的频率。那有单独 A 的频率，也有单独 B 的频率，但是这2个频率在交叉的过程当中会有一个小小的领域，这个领域当中就会产出一些共振的效果。那这个效果它可能是来自于单独 A 的频率，可能是来自于单独 B 的频率，可能是来自于 A 加 B 的这个频率的效果，可能是 A 减 B 的这样的一个频率的效果。在过去这25年当中，他还不知道说是哪一个造成这样子一个这么好这么快的一个效果，但是至少我们知道就是说这些特定的频率的组合的确是可以为我们带来很好的一个效果。那这些频率必须是特别的精准，像是如果是比如说韧带啊或者是关节，可能之间的这个频率相差只有4个赫兹，相差4个赫兹就会 直往到不同的部位，就会看不到这个效果。
明白。
Stella was also asking, because we were talking about the joint issues with the cartilage, because joint, like the knee cartilage, like a lot of people having knee issues, and the cartilage is like once it's gone, it's pretty much gone. And some people use like PRP therapy, stem cell therapy, trying to revive the cartilage. If we can use Mcmakin, the joint program, to help balance the cartilage, would really like save a lot of costs for the medical system? Do you think that would be helpful?
We have only one case report, and it's with the electrical, not the magnetic, so I can't say. But we have one case report where the cartilage in a knee was shown to grow thicker. And so I don't have data from the magnetic field about that. So we'd have it, I think, using the joint program along with stem cells or PRP would be helpful. Using it before. So if it doesn't work, if the McHealy for joint doesn't work, you can always do stem cells later.
Yeah.
那刚刚回复 Stella 老师的问题，关于这个膝盖的这个 cartilage 的这个问题，他说他目前的临床的经验来看，他只是透过微电流频率的这样一个特别的频率来去帮助这个 cartilage 的这个问题，他还没有这个临床的一些数据可以说到用脉冲电磁场的这个疗法来去帮助这个膝盖的这个部分，但是他的这个透过微电流频率的这个方式来去调整这个 cartilage 的这个问题，他的确有发现过案例是可以增强或是让这个 cartilage 慢慢的变厚一点点。那他的建议就是说，如果你希望去做其他的比较昂贵的治疗之前，你可以尝试用 FSM 来去帮助你看看有没有帮助，如果最多是没有帮助的时候，你再去找其他的疗法，可能是会比较好的一个方式。
那我的最后一个问题哈，想问一下，不好意思，伊利是这个身心灵的这样的一个三方位的这样一个平衡，我们说 detoxic 360度无死角的哈。那在你的Mcmakin 的 application 里边也有 detoxic， 那是不是也起到这样不仅仅是 physical 的，是不是我们的 spiritual 的它也有这个 detoxic 这方面
So our last question to you, thank you very much, Dr. Mcmakin, is that
I have to go to bed.
I know.
Because you know.
Okay, one more.
Okay, our body is composed of the mind, body, and spirit. So when we use the detox programs, we know that not just the physical body needs to detox, our minds, our spirits needs to have some kind of detox as well. That's the Mcmakin protocol with the detox program. Is it only working on the physical level, or does it working on the mind and the spirit as well? And how we can use in general, like how I know hydration is very important. So before FSM and before using any kind of microcurrent therapy, you can share with us some tips on how for us to have a better effects, or how to improve the effects of frequencies to help us sustain the effects. That's the last question. Thank you.
So being hydrated is important, but it doesn't take much, maybe 1 liter in the 4 hours before treatment. But when you think about detoxification, and you said mind, body, spirit, well, the detoxification program is for the liver, to help the liver process toxins and balance the function of the liver to detoxify your system. That in general will help make the mind work better, but specifically for the mind, that brain balance is what we call the concussion protocol.
Yes.
And that tends to balance the function of the mind and the stress centers in the brain. And then the emotional relax and balance, I'm not sure what we called it, but mind, body, spirit all go together but because the protocols are very specific, you would use 3 programs to accomplish all 3. In acupuncture, expecting stomach 32 to do all those things is not reasonable. You have to balance all the meridians in order to get a balanced system. So it's the same thing with the Mankili. You would use treat the worst first. So if the patient is stressed and distressed, you could treat the liver and it won't make a difference. So treat the worst first. So you treat brain balance first, and then emotional balance. If they're just distressed, emotionally distressed, and then when you treat the liver, it will be more effective. It will, when you treat detoxification support, it will be more effective. Does that make sense?
Yes,
yeah.
Makes sense. It's a very holistic approach as well.
Yeah, that's what we're about.
刚刚Mcmakin医师最后的一个回复就是说，对，的确，补水、补充身体的水分是非常重要的。也许不用那么多，就算是至少在治疗前的调理之前的4个小时，喝1公升的水，其实也是会很有帮助的，在这个频率为我们带来这个效应。那回到就是排毒的这个过程当中，其实 Mcmakin 医师说到它里面的这个排毒的这个程序，主要是会先从肝脏方面去提升它的这个生物能量方面去提升这个肝脏的这个状况，提供一个资源。那因为我们都知道说肝脏是我们其中一个非常大的一个排毒的器官，那去调整了肝脏之后呢，我们才可以能够去比如说调整其他的一些比如说情绪方面的或者精神方面的一个状况。那他会建议说，就是说除了排毒这个程序之外，那他还有另外一个叫做 brain balance， 就是脑部平衡的程序以及有情绪平衡的这2个程序搭配起来，才能够更好的去帮助我们的这个身心灵这样的一个排毒或者是平衡。还有就是说他会优先的去使用，比如说你现在目前的状况哪一个是比较优先需要去处理的，就先去处理那个情况。比如说是你现在目前是非常的有压力很大的，有受到一些精神上的创伤，你就先去调整你的这个情绪平衡跟脑部的一个平衡，最后再来调你的排毒，这样的效果会更加的好。那就看情况来去安排你这些程序。那主要是身心灵排毒平衡的话，是有脑部平衡、情绪平衡跟排毒。Thank you so much for Dr. Mcmakin to have you with us today. It's a pleasure and an honor.
Very much appreciate.
My pleasure.
Thanks a lot.
Simon， 你帮我跟他说一下啊，就是说今天晚上他都没有吃饭啊，而且我也非常遗憾上次没有去 Orlando。你跟他讲，下次我见到他的时候，我来请他吃饭啊。
Stella was just wanted to tell you that because she was supposed to go to Orlando 2 weeks ago too, but she didn't make it. So she missed the chance to meet you. And in order to appreciate your attendance to today's seminar, next time she sees you, she said she would treat out you a nice dinner for you.
Okay. Thank you so much for inviting me and for bringing me in, Simon. I appreciate it.
And then we have more than 230 participants from around the world, Asia. Yeah. Thank you very much, Dr. Mcmakin.
Thank you a lot.
Thank you so much.
Yeah.
Have a good night. Thank you.
Good night. Bye.
Bye.
I'm gonna send you some pictures for you, okay?
那我们真的是非常激动哦，
真的是哦，没完没了的问。
而且他蛮累的，因为他应该整天下来都在帮他的病人